Hi, I'm Dr. Kelly Starrett. On behalf of H-Wave OTC, I want to talk for a minute about what our fundamental goal is in using this unit. Now, when we use this incredible technology, it does two things. First of all, it gives us a momentary pause with on-demand pain relief so that we can then do what? Theoretically, get up and move more, which is really the goal ultimately in all of our modalities, is to return our ability to move through our environment pain-free and in a way that allows us to occupy our roles in society and our roles in family. Now, the other thing that the H-Wave OTC does is it allows us to get a lot of movement without motion, which means that we can be having this muscle contraction, which our brain thinks is associated with a movement. So if we don't have that, or as an adjunct to this, I want to show you an important way that we have to help our brains think differently about what's happening with our body. Now, in this time of COVID, when we are locked down and sheltered, a lot of us don't have as much movement as we normally have in our day, and we're finding we don't have access to the therapies, the modalities, the medicines, the injections, the therapeutics that usually we have to help manage our chronic and persistent pain. So if you come into my clinic, one of the first things that we're going to hand you, especially when we're talking about low back pain, is a simple mechanical breathing exercise protocol. And this actually makes the basis for how we manage any person with a complex pain syndrome. And one of the ideas here is that we can get a lot of movement in the spine without having to load the spine. So this allows us to get a ton of motion in the tissues and in the actual joints themselves without having to load or kind of expose ourselves to those sensitized positions. So here is our basic mechanical breathing practice. And what you're going to do in this practice is lay on your back and get into a comfortable position. Feet up, legs straight, it doesn't matter. However, you can find a position of relaxation. So let me show you what this looks like. Our basic template is that we're going to work on 1-minute breathing efforts. So I'm going to lay down here and get comfortable in this position. And again, I can access any one of these shapes that feels better for me. One leg, one down. If I need pillows, whatever props I need are going to be appropriate. And what we're going to do here is focus on taking the largest breath in we can. When we see people with chronic pain and persistent pain, one of the first things that we find is altered is their breathing mechanics, which actually can trigger the brain that we are in highly stressed states. And if you've ever had back pain, you know it's difficult to take a full breath sometimes, and we have altered breathing in a way of trying to create more stable structures of the spine by holding our breath. So one of the ways that we can untangle this very complex Gordian knot is to have this direct input into the brain via the breathing. So instead of falling down some kind of woo-woo, very soft science, let's focus on the mechanics. So what I do here is I'm going to get into this position and I'm going to take a huge breath in through my belly, through my nose. So what I'm interested in here is I don't have any load in the spine. I'm not contending with gravity. My hips aren't pulling on my spine, my shoulder, my neck is supported. And here, which means that my spine is unloaded, it means I can get a lot of motion here without having to move. So I take a breath in my belly, initiating through the nose, and then I'm going to let it go as fast as I can. Now the idea here is that ultimately I may not be able to breathe out quickly because I'm using that modulated stiffness of the trunk to help stabilize, and my brain is saying, no, let's move slowly. So we can use that as a cue, but otherwise I'm going to spend as much time as it takes to exaggerate how much air I can get into the belly. So big breath in, expand, let it go. Just like a balloon is switching or popping or a light switch is turning off. I'm trying to restore that springiness of my body. Now, let's understand that this diaphragm has large impacts and connections to a lot of the other musculature of the trunk. So as I'm moving this diaphragm, taking a big breath, my lumbar is extending, and as I exhale, I'm flexing, which is a really powerful way of getting small motions into my lumbar spine to restore or tell my brain, hey, it's okay for the lumbar spine to move, don't panic. So I take a big breath in, expand, 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 I don't have to exaggerate, let it go, out through the mouth. Now, that's our first breath through the belly, but we're also going to expand laterally and see if we can pick up some breathing in the sides. So what I need to do is make sure that I can expand and contract in this lateral side. If I was an Oreo cookie, I want to be able to breathe into the cream filling. So I take a breath in the belly, into the ribs, expand, let it go. And so what really is happening is I'm starting to expand as I breathe 360. I'm trying to improve my musculature and range of motion of my trunk and appreciate that the spine musculature and tissues act as a radial contractile field. This means they expand and contract, but their number one goal is to create length and unload that spine by trying to create integrity in that spinal column. So I take a big breath in through the belly, I go to the ribs, and then I add in the chest, last. And the idea here is that I'm now getting a very, very different breathing practice. So my brain is like, oh, look, we have different movements of the body associated with our system. Because what we know is that the brain is so clever that it starts to map all of these things together. Oh, shallow breathing, I know what that is. That's low back pain. Or my knee hurts, and when my knee hurts, I shallow breathe. So my brain says, oh, you're doing some shallow breathing. I wonder if that relates to the knee. So one of the things that we can do is change our breathing, and we know that that's one of the most effective ways to help get the brain to think differently about the tissues. Now, when I'm talking about back pain, what's amazing here is that I have breathing through the belly, I have breathing through the ribs, and that's a lot of motion in the neck and back. So if we appreciate that the spine and trunk is like a primary engine system, it's crucial that I have motion and controlled motion and access to the incredible movements of my trunk, and that then the shoulders and the hips sort of are like engines that bolt onto that frame. So if I don't have good stabilization or good movement here, it's really hard to understand what's going on. Appreciating that if I have neck pain, a better functioning thoracic spine will improve the relationship of head to neck. If I have a better functioning lumbar spine, I'll see better function of the lumbar to pelvis connection. Same thing with the thoracic spine and the shoulder. So what we're trying to do is, first things first, if the first movement that's responsible and crucial is this idea of taking this big breath, well, let's practice that. So again, big breath in the belly, in the ribs, in the chest, let it go. And now our basic template is this. We're gonna do those breaths and we're gonna go 1 minute on, and then we're gonna take a little rest. So the first time you do this, don't panic. You may feel a little lightheaded, you may feel voluminous, you may get a little tingly, but it's just breathing, and you're safe on your back, and there's no way you can hurt yourself with breathing. This is why we practice this. So the goal is to try to get as max breath as I can without holding it at the top. Let it be springy on an exhale, and go right back into my next breath hold, and I'm gonna do that for a minute. So it would look like this. And the goal here is that each time I'm trying to get more air into the system globally, belly, ribs, chest, low back, feeling myself expand as I did in the last breath. So each time is an opportunity to restore motion and to get some non-threatening movement into the spine and the neck. So it's incredible. Lumbar spine to neck as a system is a dynamic, kind of incredible machinery, and your brain doesn't think in terms of lumbar spine, thoracic spine, cervical spine, it just says spine. So this is an easy way to begin to get some motion in, like movement or walking, but if I can't do that and I'm on my back, I can begin this breathing process. Now, what's great here is now I have this 1 rep max idea. That's how much air I can get in, and what I do is I'm gonna try to repeat that 5 to 10 times in my first episode. So again, I drop to the side, I sneak up into my reloaded position, and I want you to appreciate that you can actually work and do this breathing drill anytime. In fact, it's one of the ways we begin to systematically load the spine in gravity is we can still work on our breathing as soon as we're sitting up or even kind of inclined on a couch. We can go right back to that breathing drill. But this time, there's actually some demands on the trunk, and so we're gonna have to breathe into some stiffness, which is good because it gets us out of this protective mechanism. So what I'm trying to do is breathe and then just be soft, but thinking about letting the musculature contract towards the spine on the exhale. Big breath in, let it contract towards the spine. Expand, contract on the exhale. What we'll find is that we can drop this in as many times as we want during the day. Our basic template is do a minute on, minute off for your first few times, and then see if you can expand that to 90 seconds on, 1 minute off, and then expand it to 2 minutes on, continuously with a minute off. And you're seeing that ultimately we're trying to build tolerance, movement, reclaim elasticity, and get how the brain, change how the brain is perceiving what's going on via the breath. The old masters in yoga used to say, the nerves are king of the breath. We know that's true. I have pain, alters my breathing, but the breath is king of the brain. So one of the ways that we can help manage our chronic pain and persistent pain when we're at home is to develop a simple mechanical breathing practice. This is the root for our rehab, and it's a perfect adjunct when I've used my H-Wave OTC to help settle and restore motion and get some movement into the system without actually having to move. Well, here is a movement exercise you can do in your bed, in your couch, in your comfortable chair, in a position of non-threat. Let's get that body moving, and let's restore what's possible with the first and most important motion of the body, which is breathing.